All right. Hello this morning. Today we are going to discuss why holistic doctors are dismissed. My name is Dr. Erica Steele. I am a holistic doctor in family practice. If you are interested in anything about our practice, feel free to check out our website. There's links below. Pretty much, I've been in natural health care for a long time and really love to educate people about holistic medicine, not just the business of it, not just the treatment of it, but really the unification of both, because it's patient and provider that has to come together for this magic, if you will, to happen. And so hopefully we can continue to dispel all these myths, rumors, and really just a lack of public health education, quite frankly. And we'll get into that today. That's kind of part of the reason why I wanted to do a topic like this. So stay tuned. All right. So, why are holistic doctors dismissed? Right. Oftentimes, and I see it in my comment sections all the time, there's a lot of questioning, challenging. You're making all these claims, and then even just in the general world, people are told, "Oh, but you're not a real doctor," or "Did you go to real school?" or any of those. Really, it's just unconscious bias, and that happens in medicine and that happens in healthcare every single day. So let's start talking about it. Let's start really getting into the nitty gritty of it and understand why we have these biases towards holistic doctors, and why we don't seem to understand that our profession has been around for a very long time and unfortunately has been a profession that's been impacted from colonization and Western culture greatly, really in replacement for this inefficient, highly expensive, inundated healthcare system that unfortunately is not serving people well. Is the third leading cause of death. Medical errors is the third leading cause of death in this country. And so there are quite a few issues that are arising. And there's even natural doctors abandoning conventional practice and jumping over to the natural world. So what is that? What does that even say, right? So let's kind of first talk about unconscious bias, superiority bias, and the lack of public health education. So unconscious bias, if you're not aware, is how unconsciously you think about something. This is created based off of behaviors, actions, experiences from the past. So if you have no experience with natural health, or your experience has been poor, or your experience has been not a good experience, you're going to have unconscious bias. Also, too, if you've had a good experience and you've grown up with it, again, you're going to have an unconscious bias that it's a good thing. So unconscious bias can go either way, right? But here's what has happened in healthcare is that these practices, ancient and indigenous practices that have been passed down through generation to generation, many, many years, right? And has really been the foundation of our healthcare, especially as Black and Brown people. And so now with this westernized culture that has come over, really and taken over, even going back into, early colonial days, I have some really good research about this that I want to share. So even that colonial impact, Murzul, 2005, I hope I pronounced his name right, Western colonization imposed allopathic medicine in colonized regions, dismissing all of our indigenous practices. So right from the jump, when any kind of a colonizer came in, all of our practices immediately had to halt. Our food, our medicine, how we treated, all of that was considered barbaric, unscientific, and we were then having to adopt, all of these other practices. Remember too, all the diseases came when colonizers came because of sanitation practices and because of just how they were, living. And so again, we go into, this dichotomy of superiority. And then we know with the rise of allopathy and homeopathic and naturopathic practices, they were labeled unscientific, and driven lots of high margins. That's Coulter 1973. But that was really done in the early 1900s, when Rockefeller began to take over healthcare, started investing in the AMA, started investing in all of these, different systems that we know to be this day. And all of those communications, unscientific, evidence based, were all words, their dog whistles pretty much to let you know we're better, we're superior than these indigenous traditional practices that are unscientific. Nutrition's unscientific, herbs are unscientific, but we know all. So you kind of can see how that goes. So the pharmaceutical companies and the medical associations really took over and further marginalized holistic practices by promoting only drug-based treatments. As you're aware, when Rockefeller sent, and also Carnegie was involved in this, when they sent out Flexner to create the Flexner report, when going to all the medical schools and discrediting all the natural practices in favor of pharmaceutical, because Rockefeller is in big oil, was in big oil, is a part of big oil, and so they wanted to take natural substances like herbs and combine it with synthetics such as oil, put those together to patent drugs. So they wanted to make sure that they created this medical monopoly, and we see this economic and political influence. It never has been about the science. It's all been about the profit and the profit margin and who's making more money. So we saw the culture naturally shift to the scientific medicine, where the cultural shift in Western societies equated scientific method or allopathy with progress and being modern, and all holistic approaches as outdated, less effective. That was Kapchuk 2002. So we see these themes, that we're being presented with. It's constantly that, what they do is better, even though it's ineffective, even though it's the third leading cause of death in our country, even though you don't know anybody who has not been a victim of some sort of, medical overlook, or, medical overreach, or just improper treatment or bad bedside manner. We have all of these experiences, but this is considered superior, right? And then holistic doctors, we are heavily scrutinized, to the point that, we have magnifying glass on us every single moment for us. They're looking for us to make a mistake pretty much. And then if you are a rise above, where you do a lot of your due diligence and you do heavy amounts of education, now all of a sudden, every single appointment, every single interview, every single interaction, social interaction, you are now the bearer of defending the profession and continuing to defend why you are choosing this subpar treatment, right? So you're already, no matter how scientifically valid your statements are, because there is this cloud of unconscious bias and superiority bias, you're not, you're in, I'm already coming into the conversation at 50% deficit. You're already looking at what I say as not valid, not real, not trustworthy, not scientific, because I've left the conventional medical model in really, you know what word would I use? I would say in solidarity of my people's practices. See, these are practices that I grew up with. Many of these practices far outdate our Western, medical culture. And so, but they're nuanced, and unfortunately, because of the obliteration of natural and holistic schools in the 40s, and even Black medical schools in the 40s, we've been whitewashed, and we continue to go into a system that continually fails us and continually flaws us. Um, because of our lack of public health education, we literally are just resting on the unconscious bias of, oh, well, that's kind of weird, and I don't know, and there's a whole bunch of, woo woo in it. And, there's so many different wise tales and myths that are spoken about our profession. And there's not a lot of true education. Again, we use the scientific method in every single appointment. What's a scientific method? We listen subjectively to our patient. We have to, right? We listen to all the nuance. When you come to an appointment, it's usually 30 to an hour. It's not 15 minutes in and out, and you're only focused on your symptoms. We look at your total health. That's your water, your nutrition, your mindset, your emotional health, your physical health, your spiritual health, your sleep schedule, supplements, medications, everything, right? Like, put it all out on the table. And then we listen to that, and then we have a hypothesis, which is pretty much just a sophisticated guess. And then we use our health data to decide, okay, was my hypothesis right, wrong, good, bad, up, down, right? And then we put the patient on a treatment based off of all of that data. And then we modulate it, we keep watching it, we monitor it. I monitor every 3 weeks. Some, patients get monitored every 2 months. And we use remote patient monitoring, where we're looking at health data, we're looking at vitals, but the difference is we're teaching patients about their numbers and what they can do proactively. We're not waiting until there becomes a problem and then all of a sudden, running around like a chicken with our head cut off, trying to put the fires out with the most expensive, most invasive treatment possible, because that's conventional medicine. Holistic medicine and natural medicine, we're teaching you how to live. We're teaching you how to think. We're teaching you how to breathe. We're teaching you how to eat. We're teaching you how to sleep. We're teaching you how to be a holistic human being on this planet, operating on all cylinders, mind, body, spirit, consciously. You're tapped in, tuned in, what does Esther Abraham Hicks say? You are all those things. You're self-actualized, right? You are elevating, right? You are completely grounded into your human experience. You're feeling the things, you're thinking the things, you're eating the things, right? You're choosing the things. There's a lot to this practice. It's not just what people think in terms of, supplements and herbs and all of that kind of stuff. So again, we talked about this marginalization. So, when Western med took over, when Rockefeller took over, or even the colonizers took over, back when we were taken or genocided from our lands, all of our original, think about it, we had all of this. We knew what herbs, like even living in St. Lucia, they still practice bush medicine, right? Because the conventional medical system has not taken over, right? So bush medicine and herbal medicine, and food, using food as medicine is very much still a part of the culture, and if you look at cultures that are not as heavily westernized, they still have connection to that, right? But then when you bring in this Western colonized model that discredits everything that our ancestors did only in for alignment with man-made, synthetic, conventional, harmful practices, while you're dismissing what has actually gotten us here, it's incredibly harmful. And then when you look at the history of marginalization, you look at, again, the settlers, you look again at, the impact of Rockefeller, the still impacting to this day. You look at these marginalizations and you wonder why in the media, every time you see a holistic doctor, we are perceived as quacks or anti-vax people. We are often vilified. We are shown and depicted in television shows, even doctor shows, as literally quacks, as literally crazy. They always show us in a certain way. Why is that? That is unconscious bias. They are presenting a narrative to you of who we are. And because many times they have murdered us, they have put us out of business, they have, done all of these things, put us, many of us in jail, etc. Because they've done all of these things, they can get away with it because there's not many of us. Our profession has been dying off because of colonization. So we can't even compete with advertising dollars, with education, to help people to understand this medical monopoly that has literally swallowed and taken over everything, right? So you're just a consumer. What part of the scientific method is ask your doctor about this medication? Why should you be asking the doctor about a particular pharmaceutical treatment? Shouldn't it be the other way around? Shouldn't your doctor be listening to your healthcare concerns, being up to date with all the treatment options available, and then make a recommendation based off of your specific health data? And then giving you a treatment plan and then monitoring that treatment plan. Because that's what we do in holistic medicine. I don't know about conventional medicine. Actually, I take that back. I know a lot about conventional medicine. You, unfortunately, as the general public, don't know a lot about it. And so, I'm one voice. There are other voices in the spectrum, but I have a very unique perspective in this because it's not just about giving people supplements and running lab tests. It is really about protecting our natural indigenous practices. There's nuance to this stuff. There's spirituality involved with this stuff. There are things that are not considered part of the Western model that if you don't practice, it becomes less effective. You can't just mentally power your way through this work, not if you are intending for that patient to have a powerful transformational healing and for them to get to the root cause emotionally, psychosocially, and spiritually as to why they've manifested that disease, to ensure that they don't manifest it again, and then to ensure that they get the spiritual, mental, emotional, psychological, physical, spiritual. I know I keep repeating myself, but I just want to make sure that you understand that if you don't get to the true roots, right? Because the roots are not your physical manifestation and expression of disease. Your roots are the intention, the mindset, the emotional charge, the lack of emotional processing, the trauma that has been stored in your body that's inhibited your organ function for however many years, generations, etc., right? And then you're living in an environment and making decisions based off of unconscious bias, based off of subconscious traumas and wounds, right? And you're reacting primitively constantly to these different environmental things, these different happenings that happen outside of yourself. You're triggered by fear, and then you're reacting by taking this supplement and taking that herb and doing that treatment with no scientific method, no structure, no understanding if it's effective or not. You're literally just throwing things out. You're throwing paint up against a wall to see what sticks. So then we're vilified and said, oh, but we're just money hungry, we're just scam artists. But if patients saw us as actually the valid professions that they are and went to qualified professionals who understand scientific process and actually do a treatment plan, you would see far more effectiveness. And even when we look at specific studies, right, using different modalities, using nutrition, using supplements, using acupuncture, using natural things. I'm not an acupuncturist, but that is another holistic practice. So using these, particular modalities, it has been proven even in the Western scientific structure. But what happens, no matter how much we present the information, they dismiss it. They dismiss it for, again, we're back to superiority bias. If it's not their, you know, world, if it's not what is skewed and biased to sell their prescription supplements or their prescription medications, excuse me, or their procedures, then, it doesn't work. So again, you know, dog whistles. When I hear the word unscientific, when I hear the words evidence-based, those are dog whistles. I know that we want things to be evidence-based, and I want things to be evidence-based too, but using that word as a dog whistle to discredit any natural holistic practice, right? That doesn't mean we lack science. And that also doesn't mean that I have to wait for the NIH or the CDC, to figure out whoever they're paying so that they can give me unbiased healthcare data. If I, and we saw this in COVID, if I had to wait for NIH or CDC to tell me what to do, patients, and patients did pass away. So none of my patients passed away during COVID, and I had high risk cases. I had people calling me even from the hospital, and I got them out, right? So how did I do that? I did that because I understand scientific method, but also I have their own health data. I don't need to wait for somebody else to tell me how to do my job. And I say this with respect. Okay. And I know that many doctors were trying trial and error, but if you understand how the body works, the trial and error is not that steep. You're not having to guess a whole bunch of combinations. There is a specific therapeutic order and a specific way in which that we stabilize and heal the body. And if you don't know that structure, then you're going to constantly be, chasing after symptoms and trying to do patch jobs. And so there, again, because of marginalization, because of systemic racism, because of unconscious bias and superiority bias, there is a constant dismissal of natural practices. And anytime me as a scientist or me as a doctor speak out against conventional practice or conventional thinking, I'm vilified. I'm called names, right? Why is that? Because I'm not conforming to the system. I'm the whistleblower, right? What happens with the whistleblower? Sometimes the whistleblower gets protected, but most of the time the whistleblower doesn't get protected. The whistleblower gets punched down on even more because why? They're blowing the whistle, and I'm blowing the whistle. Historically and scientifically, allopathic conventional medicine has not had your best interest at heart, truly. And if it was really about the best interest of the patient, why can't we work collaboratively? Why can't we all work together as a team? Why are we so threatened? Why is it, you denigrate? Why do you look down? Why? Because that's what you've been taught. You've been taught in medical school that what we do is unscientific, barbaric, and lacking evidence. That we're just a whole bunch of charlatans, anti-vaxxers. We are a whole bunch of negative, hippies and quacks. We're just, it's the same thing. Like it's just yeah, but really we're social change warriors, we're whistleblowers, we're people that absolutely are standing up against a highly corrupt system, in support of humanity's health and their forwarding of health. It's not sustainable to continue to expect health in such a corrupt system. It's just not sustainable. How many stories do you have of medical failures, of going to doctors, being dismissed, gaslit, stonewalled, not being told that everything's normal? It's all in your head. Maybe it's stress. You need to lose weight. It's just because you're getting older. All of these dog whistles that you've been told that aren't true. It's all just genetics. There's nothing you can do. This is what you have to do for the rest of your life. We're sorry. You just have to take this for the rest of your life. There's no cures. Now, I'm not saying that there aren't very specific conditions because they, again, deeply nuanced, right? But I'm saying there is a huge part of our patient population that's being told this mess that is not true, right? Losing weight is not guaranteed to help with metabolic conditions. Weight is actually not necessarily a predictor or an indicator of health. Obviously, when you have BMI, excuse me, not BMI, when you have your weight and your waist circumference, at a certain place, that indicates visceral fat, et cetera. That's different data metrics. But even as I stated, BMI, we're all indoctrinated BMI. BMI, excuse me, has very systemically racist roots. That's why we don't use it in conventional medicine. We use body composition. Body composition looks at visceral fat. It looks at lean muscle mass. It looks at total body water. It looks at fat in the body based off of each area because it's specific. We want to really understand to the complexity. We want to create a personalized routine, right? You have to track your food. Why do you have to track your food? So we see what you're doing. So we understand what you're doing and what mistakes you're making and what things that you're doing well and how can we support you in doing the things well while also educating you on the things that can be harmful for you. What supplements are you taking? What quality of supplements are you taking? Are they GMP certified? Have they been tested? Have they been rigorously assessed for contaminants? Is there proper dosing? Can they move the lab markers the way they need to move them? Because they're just medicine. A supplement is just that. It's to supplement your diet, not to replace, right? Do you have healthy detoxification practices? What about mental health practices, emotional health practices, good relationships, good work-life balance? Do you prioritize your self-care? This is all stuff that we look at. How's your time management? These are all things. How's your boundaries? These are all things that we look at, right? These are all practices that are being dismissed or are being farmed out like, oh, okay, so conventional doctor does XYZ, but then a psychologist does XYZ, then a specialist does XYZ, then it's all, broken out. So you can't really heal in that system at all. Yes. So I just really wanted to, bring this point home why holistic doctors are dismissed. It's not a lack of science. We have to, I've been in the profession for 20 years. In order to be in the profession and be successful for as long as I have, you can't do that without not knowing what you're doing. I would have been laughed out of town. I would have been in jail. I would have been, murdered by now if I was some sort of charlatan or crook. Let's be real, especially I was practicing as a Black woman in the South. Come on. And they tried many times to discredit me, get me to go away, and even attorneys told me, Erica, they just don't want you here. Maybe you should leave. So I understand what I'm up against. I've been up against it my entire life. I'm up against a corrupt system. But what I will not tolerate on any of my channels or any of my platforms any longer is disrespect and dismissal of my scientific method or my scientific process. I'm not going to be put down. I'm not going to be made to feel as though I'm less than, just simply because I made decisions with my healthcare and with my education. Every single school that I went to, I highly vetted them, I curated them, and I chose them consciously for particular reasons. I was not unconscious when I went to school. I knew exactly which schools I was going to. I researched them heavily. I looked at all the competitors. I even went to different in services. I spoke with students, faculty. I did my due diligence in every single school that I've been to. And I was led to every school that I've been to actually serve in the role that I serve to this day. So, let's talk about the actual science of the matter, and let's not try to attack people personally. Okay. Because when we start to use ad hominems, then we know that there's absolutely no basis or credibility to your claims. You've literally lost the argument, and now, you're using whatever you can in order to, again, be superior in the conversation. And so superiority bias is coming to an end. Unconscious bias is coming to an end, especially when it comes to healthcare. And I'm not going to stop educating people. So here we go. Thank you guys so much for tuning in. Please like, share, subscribe for much, much more on this topic.